morning, everyone. I hope everyone is fine and doing good, right? Today, I came up with another topic regarding the neonatal disorders, that is the neonatal seizures. Yes, I will talk about the seizures which are seen in the neonates or in the first weeks of the life. Let me introduce this neonatal seizures. The most prominent feature of neurological dysfunction in the neonatal period is the occurrence of these seizures. These seizures they constitute a medical emergency because they signal a disease process that may produce irreversible brain damage, which may lead to some of the manifestations of these seizures. Let me define the seizures. A seizure is defined as the paroxysmal behavior which is caused by the hypersynchronous discharge of a group of neurons. These neonatal seizures, these are the most common overt manifestations, or we can say the neurological dysfunctions which is seen in the newborns. These seizures are usually classified in various types. The first one includes the subtle seizures. Next comes the tonic seizures. The third one comes the clonic seizures. The last type under this classification comes the myoclonic seizures. We'll talk about them in a manner way, in that the first one will come as a subtle seizures. The subtle seizures are usually seen in the preterm babies. The clinical manifestations in this type of seizures will be mild and they are frequently missed. That means we are not able to find out the manifestations of this type. Usually there are some mild proximal alterations in the motor behavior, or you can say the autonomic functions, that are not clearly among all types. The manifestations under this type may include the blinking of the eyelids, the fluttering can be seen, drooling, yawning, or the presence of apnea in the newborn. The next type which comes is the tonic seizures. This type of seizures is characterized by the sustained contractions of the facial, limb, as well as the other muscles of the body. These type of seizures can be the focal or they can be the generalized type of seizures. In this type of tonic seizure, that's the focal tonic seizures, it involves only one extremity and it is oftenly associated with the electrographic chains. Next, among these comes the generalized focal seizures, which may manifest with the tonic extension of the upper as well as the lower limbs and may involve the axial musculature as well. The third type comes the clonic seizures. These seizures often involve one extremity or one side of the body. The rhythm of these clonic movements, it's usually slow at 1 to 3 movements per second. If we talk about the myoclonic seizures, so in this type of seizures, there will be single or the multiple lighting fast jerks or the upper or the lower extremities, and it is usually distinguished from the clonic seizures because of the more rapid speed or the jerks present in this type. In case of the seizures are very massive, they will indicate there is a presence of brain injury and the injury has the poor prognosis. In case of the non-epileptic movements, we'll see under this condition, the jitterness or the tremors will be present. The normal movements will be very easily seen in case of the preterm infants. Now we'll talk about the etiology of the neonatal seizures. As I mentioned, the seizures they may occur when the large number of neurons they undergo excessive synchronized depolarization. So some of the etiological factors may be like the developmental and neurological problems. That may include the congenital hydrocephalus, as it means that there is an excessive fluid present in that is the cerebrospinal fluid present in the brain at the time of birth, which may increase the intracranial pressure and results in the brain damage. The next neurological problem may be the microcephaly. That means the baby's head is smaller than expected in pregnancy. Cerebral dysgenesis, it's another neurological problem which may be responsible for causing the seizures in neonates. That means it's a kind of brain malformation which is characterized by incomplete brain division, or there can be the incomplete organization of the development of the brain. Next etiological factor can be the perinatal complications. The presence of birth asphyxia, that means the child having the oxygen cessation. There can be the presence of intracranial hemorrhage. In case of the birth injuries, maybe due to the force of delivery, or you can say the instrumental delivery, which may lead to the injury of the baby's head and can lead to the seizures. Next cause can be related to the metabolic problems. For example, the hypoglycemia, when the sugar level of the infant is below the normal. There can be the chances of the lower levels of the calcium presence, lower level of magnesium if present in the infants may be the cause. Presence of hypo or the hyponatremia can be the indication. In case of the hypobilirubinemia, especially with the connectors, which involves the brain of the infants, have an impact over the presence of seizures. Then we'll talk about the next cause, which is the perinatal infections. In these infections may include the meningitis. You may be aware of this, as this is the swelling or the inflammation of the protective membrane which is covering the brain and the spinal cord. Next comes the septicemia. That is an infection that occurs when a bacteria enters the bloodstream and spreads throughout the body. In case of the intrauterine infections, for example, the TORCH, that is the toxoplasmosis, there can be the rubella, cytomegalovirus, as well as the herpes simplex, which may be the cause that may lead to the seizures in infants. The last cause under this condition may be the drugs. If the mother during the pregnancy has the habit of consuming the narcotics, if the mother is on the theophylline drugs in case of any lung diseases or the respiratory infections, then we'll talk about the diagnostic evaluation, which may be helpful. It is important, but it is difficult to at times to establish the cause of neonatal seizures. Some of the diagnostic tools which will be helpful in finding out the disease. At the very beginning, we'll be asking about the history. So the first thing under history, we'll be asking about the seizure history. That may include the history of the birth. It may include the type of seizure and the onset of the seizure, as well as some of the associated manifestations which an infant developed. Next thing comes under the history is the antenatal history. As we have seen some of the causes which are related to the period of pregnancy, so it may include if the mother has any kind of intrauterine infections, if the mother is diabetic, or there is an addiction of the narcotics. Then the perinatal history, it may include the history of the distress, or there can be the history of the instrumental delivery. In case of the family history, as it may be one of the cause for the seizures in infants, which includes the history of consanguinity, or there may be the family history of the seizures in the siblings especially. So the investigations other than the history collection may be the serum glucose. The serum blood glucose level has to be checked. The serum electrolytes can be checked, as the transient neonatal hypoglycemia as well as the hypocalcemia are the main causes of the seizures during the infancy. Then, under this investigation, the cerebrospinal fluid analysis can be done with the help of the lumbar puncture. The cerebrospinal fluid sample is to be taken and it is analyzed for the presence of any kind of infections or the blood due to the intracranial hemorrhage. Then, some of the imaging studies can be helpful too. For example, the cranial computer tomography or the MRI, which is done for detecting the parenchymal abnormalities as well as to predict or to detect some of the congenital malformations. Electroencephalography can be helpful too. It plays a vital role in properly identifying the neonatal seizures from non epileptic events. And finally, we are going to talk about the management of these neonatal seizures. At the first itself, before starting any kind of the treatment, the seizure is to be identified and the characteristic of the seizure is to be identified. Secure airway is to be provided along with the optimized breathing and circulation. Secure intravenous access for any kind of fluids and take some of the samples for the baseline investigations. If the seizure is acute, it has to be treated aggressively. So it depends on the cause, which may be the factor for the seizures or treated accordingly. For example, in case of the electrolyte imbalance, for example, in the hypocalcemia, which is corrected with the 5 to 10 ml of calcium gluconate, which is given intravenously, and administer bolus dose of 50% glucose, that is 1 to 2 mg per kg, given for the hypoglycemic infants. Then the anti-epileptic drugs, for example, the phenobarbital, which is the drug of choice in treating the seizures in the infants. Phenobarbital, which is given 20 mg per kg IV over 10 minutes, and therefore a maintenance dose of 5 mg per kg is to be continued as a single dose, or it can be divided into two doses. If the seizure still persisted after the medication of like the anti-epileptic medication, then the use of phenytoin can be considered. In case after giving the phenytoin administration, if the seizures still persisted, or if the seizures still continued, then the administration of the benzodiazepines, for example, the lorazepam, which is given at 0.05 mg per kg intravenously, it is given over 2 to 5 minutes, and midazolam, which is given as 0.15 mg per kg IV bolus, or the clonazepam, which may be employed after the medication is not yet, if the medications are not working, the medications which are administered before these benzodiazepines. Then the important again, the management, that is the nursing management. First of all, the emergency care as well as the observation during the seizures, it's very important. First of all, lie down the child over a flat and safe surface. If the child has the tightened clothes, loosen the clothes immediately. Do not force into the child's mouth immediately when the child starts seizures. Let the seizures run, and it may take its own time till it gets complete. When the seizures stop, turn the child over the one side so that the drooling of the saliva will be like it will occur to prevent the aspiration. The breathing pattern is to be maintained, or it is to be checked accordingly, and if possible or if needed, the CPR is to be given. Until the child is fully conscious after this episode of the seizures, the child is to be observed continuously. In case of any injury a child or the infant got during the episode of the seizures, it is to be treated accordingly. Now we'll talk about the prognosis of this condition. Best among these seizures is the focal clonic seizures, which carries the best prognosis. Among all these, the myoclonic seizures that will carry that carries the worst prognosis in terms of the neurodevelopment outcome and the reoccurrence. The seizures which are related to the hypocalcemia, which are related to the hypoglycemia, as well as the cerebral malformations, they have the adverse outcomes. So let me conclude this topic which we were discussing today in today's session. So the seizures which are very commonly seen in the neonatal period than any other period of the life, and the subtle seizures, which is the first type which we discussed under this classification, that are the most common form of the seizures which are seen. And the phenobarbital, it's the drug of choice which is used during the seizures of the infants. So I hope you got the idea regarding the neonatal seizures and the management, especially which is to be done during the episodes of the seizures. And I'll see you in the next session. Till then, stay connected and stay safe.